most famous physical therapist on the internet.
Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. In our opinion, of course, Bob. I just can't stop. It's all part of this program. Then I'm Brad Heineck, and I'm exactly one half of the Bob and Brad team. And here we have Chris the Pharmacist.
Hey, guys.
We're happy to have him here. We're actually ecstatic to have him here. We're going to talk about vitamin D, how it fights COVID and boosts your immune system. However, 42% of Americans are deficient in this really important vitamin. But we're going to show you the fix and how you can take care of that. Anything else, Chris, before we get into the...
Yeah, I mean, as far as vitamin D...
No, not about the program, about yourself.
Oh, no.
No, you have researched this in detail.
Oh, yeah. No, I mean...
So we've got updated information.
I talk about vitamin D on a daily basis, actually. So
it's your customers.
Yep. Patients come in. We talk about it. Actually, customers, patients, doctors, nurses. We talk about all of them. So, So, no, we are up to date and ready to rock and roll.
So the thing about vitamin D, at least I think across the board, is everyone knows or assumes it's the bone drug, the bone vitamin.
Yeah.
It's going to help your bones get solid so you don't, particularly as you get older, as you get into that, females with menopause and males as well. We want to get more vitamin D, but all of a sudden, what is it doing with, immune system and COVID? It's really a big factor in your health.
It's a large factor. Yeah, I mean, bones is just a part. We call it the sunshine vitamin because it's one of two vitamins that we naturally make on our own. We make vitamin D and vitamin K. And
you mean from the sun?
Yep, from the sun.
So we just go outside. Exposure.
But the problem is when we live over the 37th parallel, which we do. We're in Wisconsin here. Well, actually, we're in Minnesota here, but we. Above that parallel, basically the way that the Earth is, the angle of the sun's rays just don't hit us. So really our time to shine, so to speak, is pretty much from March until October. And after that, so we get into November and we get all the way through February, we just don't get the sunshine like the people in the southern states get. And so for us, it's important probably to supplement, although the good news is for a lot of us, we do tend to store it. But as we age in particular, when we get to the age of 65, you only manufacture about a quarter of the vitamin D that you used to when you were a young whippersnapper.
Well, just wait a second, Chris. I want to back up just a little bit. So 42%, and this from studies show that 42% of the population in the United States is probably more north than south, according to the sunshine and the parallel information you just gave. But that's almost half. Well, it's getting pretty close to half of the people.
And worldwide,
is there any symptoms could you start feeling sick, or do you have your skin change?
It's the funny thing about D. We talk about vitamin D, and it's actually a hormone. And, symptoms of vitamin D, most people don't even know they're deficient. So we just kind of walk around, everything's going all well and good, and all of a sudden your doctor decides to take a lab exam, and you're like, oh, you're low in D. But there
so
can
that's
be
in blood that'll show?
Yeah. So
or maybe with bone density tests.
I mean, you can have there's subtle signs that can tell you, like sometimes it can affect your mood. So people that are more depressed, all of a sudden they take a D level. Oh my gosh, you're really, really low. Take some vitamin D and all of a sudden you're not on antidepressants. Life is good.
That's a pretty good deal.
So obviously for bone, so if you're low and some people express bone pain, so all of a sudden bone and muscle pain. And interestingly, vitamin D actually helps with our muscle functioning. So all of a sudden you just kind of feel clumsy all of a sudden, or just things aren't working right. Could be that you're low in D, but the only way you would truly know is to have a laboratory value drawn by your physician. Or ordered by your physician, then drawn by the laboratory and interpreted. But I mean, it's one of those things where it's kind of hard to just on average just go, I think I'm low in D. If you're more prone to upper respiratory infections, that's a big thing. D has a huge proponent in helping our immune system's response. So that's why it's important today with COVID. It's also important with influenza. It's important with breathing conditions like asthma and COPD and emphysema.
So with COVID, right now it's, things are improving, but how does vitamin D, there's sort of some research that correlates vitamin D and COVID.
We do. I mean, it's not a magic bullet, but what we have seen with the people with the most severe infections, they are severely deficient in vitamin D.
It's kind of a common
and so they have a range of measurements, and what kind of the happy zone that's mostly agreed upon is somewhere between 30 nanograms and 60 nanograms is an optimal level per milliliter, is the optimal level to have vitamin D.
So
When they have
these 30 what does that mean to the average person? Is there something we can relate to?
there's nothing. I mean, you figure a paperclip is a paperclip weighs 1 gram, so it's 9,000 or nine. It's a billion times smaller than that. So
we're talking small amounts, but this is amount we could get from the sun.
Yeah, your sun, like I said, you go outside for 15 minutes when it's optimal.
In the summer?
In the summer, you're gonna in 15 minutes you're gonna make about 25,000 IUs. So what does that mean? Well, it's just a value that our bodies seem to create, and it's stored in our fat cells, and it elutes over time when our bodies need it. So for our muscles, our bones, etc.
So as far as COVID is concerned, we want to make sure we're getting enough. And then if you live in the north, we're not outside that much. It's cold. We're covered up anyways.
Yep.
So that might be a time to take
supplement. Yeah, and like I was saying, is when you get to these very severe cases of COVID, they all seem to be having below about 20 nanograms per milliliter. So that they've seen that. They don't know why, other than, and of course it's an older population that tends to have that more severely. A quarter of people over the age of 65 also are making less D than you make a quarter when you're, excuse me, I misspoke. When you're 65 years old, you make about a quarter less. I mean, you're down to about 1/4 of your vitamin D making capacity than what you were. So that might be a correlation. Things that they are researching. This is not definitive. It is not set in stone, but it's something that we're observing. And so to supplement vitamin D is probably a very helpful thing to do, whether you get it through your diet or whether you get it through the vitamin aisle.
And the thing I want to question on the sunlight thing is, I was outside last week and it was, 10 below. We were cross country skiing, but the only thing showing was my face.
Yeah, you probably only had about this much room.
Completely covered, yeah. And if you got sunglasses, so I'm assuming that you're not going to be
not
very
cutting the
effective.
mustard. I mean, even if you're outside and the winter months, the problem is the angle of the sun's. It's not so much the temperature itself. The sun is the sun. It's the angles of the rays and the UV radiation
So
that
it gets
you're
filtered
absorbing
out through the atmosphere.
Yeah, so there's nothing you can do about it. I mean, we just live north, and we're just not going to be able to manufacture like we would, because you can't take your coat off, and the sun's rays just don't really coincide.
And
with
we
that.
don't want to dispel the people in the southern hemisphere, like in Australia, New Zealand. Those people, so
the Earth is
it 37 degrees down there?
Both sides. Yep.
Okay,
both sides.
Up.
Yep.
That's good.
So it's it's the same. We're basically round.
Yeah. And if you're not sure where you are in relation to 37 degrees, I think didn't you just ask your phone and it?
Oh yeah. You could say, where's the 37th parallel? And it'll draw, you can see a dozen different types of maps. So I mean, it's just basically, if you look at Texas, four corners, I mean, it's just a line that just goes right through the south.
And through Europe? We've got a lot of European listeners.
Yeah, so it'd be the 37th parallel. It goes all the way around the planet.
Yep, so right around Italy, is it?
Yep, I think so.
Northern part?
Just as you start to go north from there.
I'm testing your geography.
Yeah, well, yeah. I mean, it's northern, like north of Saudi. I guess UK. I mean, they're all north of all that.
Sure.
So, yes.
When it gets cold. Anyways, you could probably guess with her if you didn't have enough sun. What else do we want to talk? Oh,
well, supplement.
Diet. What about diet? If people don't want to take the supplement, can you modify your diet and
Absolutely, you certainly can. So, I mean, you can get it through. I mean, a lot of the foods that we eat are fortified with D because many of us live in this over that 37th parallel. So as a result of that, a lot of the foods and cereals, dairy products actually add vitamin D to them. Mm-hmm. But natural sources of food exist too. So it's going to be your fatty fishes like your salmon, your mackerel, your sardines, swordfish, excellent source of vitamin D. Ooh. You can get it through green leafy vegetables. You can get it through nuts and legumes. So, I mean, there's a lot of ways you can get it.
Say if you're an older adult, you said when you're 65 or older, you have your body doesn't
your capacity is a lot lower.
So at that point, could you get it through diet, or maybe should a supplement?
I would recommend highly supplementing. I think because even not all of us are going to eat fish 3-4 days a week. Mm-hmm. I mean some people do that are coastal, and certain people in like Japan, that's a staple of their diet. Right, so it's not going to be a problem. But the reality of it is most of us, it's probably going to be simpler to just simply take a 1,000 IU supplement on a daily basis.
So 1,000 IU, that if you look at the box,
it'll also be noted as 25 micrograms because they're kind of changing the nomenclature with vitamin D. So just be aware that you could see whether I say 1,000 IUs or 25 micrograms, it's the same dose.
Okay. And if you could just buy it online or any pharmacy or store, is there any name brand or quality that you want to look
No,
for?
I mean, I would tell you to buy a D3 supplement. So there's also D2,
Ooh.
which is a plant source, but D3 is a meat source. So basically, from that regard, D3 is more readily available. It does more for your body. So as a consequence of that, and particularly in pharmacies across America, I can tell you that everything on the shelves are D3, whether it's in a multivitamin, whether it's coupled with your calcium supplement, whether it's in a standalone D.
So that number is telling you where that source came. You said it was from a meat.
No, it's just the type of D supplement. I mean, there's D2 and D3, and so basically they're animal sourced. When we make vitamin D through the sun,
Yeah.
it actually gets converted to vitamin D3.
Oh.
It's more bioactive. It's the better source,
Okay. So
So-
if you're looking, make sure it says D3,
and it will say D3. I mean, you're not going to find anything with D2.
1,000 IUs.
That'd be about, yeah. The RDA recommends basically you want to be between 600 and 800 IUs of daily dosing of D.
Oh, okay.
So if you have a multivitamin, a lot of those only have about 400 IUs in it. So and if you take, and then there's D supplements that actually, when you go to any pharmacy or online, you will see a multitude of ranges of D. Now these days there was a study that came out about 6-8 months ago that suggests that taking really high doses of D probably not the most appropriate. So you want to make sure that you're working with your doctor when you're supplementing these things, because just like anything else, a little is just right. Too much is probably bad. So we
Sure.
don't want to double up on that thing. So
Can D have problems with other medications? And
no,
or is
D
not-
is not going to have problems. The nice thing is because it's something that we naturally make with our bodies. It's not going to have like a drug-drug interaction like you might see with certain, timing of certain medications.
Sure.
So that's the nice thing, because it's natural and it's within our body. So you're not going to really be allergic to. You'll be allergic to maybe something that's in a capsule, but you're not going to be allergic to the vitamin D itself.
Sure. So, and I think we talked about this. Can't you, if you get too much of it, doesn't your body store it for another day?
Yeah. So if you go outside, let's say we talked about that 15 minutes, and let's say you didn't use sunscreen and you stayed out longer and you got a lot more D than you should have. And although we want to take care of our skin with skin cancer, but that's a whole
Right.
different discussion. Your body just stores it. So once so we're outside, and let's say we made more D than we can use, it's just stored in basically your fat cells. It's a fat soluble vitamin, and so as our body, and we do store it, and that's one of the advantages of our being able to make it ourselves. We think probably.
So
from
the sunlight D is absorbed, but not through the capsule.
Yeah, no. And when you take a capsule too, that's the other thing important to note, that you want to take the timing of it is probably pretty important. You want to take it probably in the morning or lunch or
Okay, with
mealtime with food.
Okay.
Very important to take with food, and you want a little bit of fat in that food because it's a fat soluble vitamin.
I
So
see.
it drives the bus into the system, so it helps it to absorb more efficiently into your system. So it does the things that you want it to more efficiently.
We're talking like meat or fish or
Meat, fish, dairy products, yogurt.
Oh.
Perfect. Yeah, any one of those things. Nuts.
What about avocado?
Perfect.
Okay, then it's in my ballpark.
Yeah. So no, all those things are very perfect things to help. And basically, it's kind of like getting on a bus and then taking a bus to the stop. I mean, you take it with a fatty meal. It helps to just get it into your system. Your system absorbs it better.
Sure.
So ultimately, it's going to go to your and you're not going to. Even with a daily supplement program, it's going to be probably more D than, because you're going to be eating foods and you're going to be getting more than you need. So some of that's going to be stored in your fat cells.
Yep.
And as time goes by, your body says, I need some D. So my bones need help. I need some calcium in my bones, my immune system, my mood. I mean, all these things.
The mind is this a
Yeah.
churning.
So it just keeps going. So, I mean, that's really, it does what it needs to do when it needs to do it.
So when you got good sunlight, I mean, do you need to take your shirt off to expose more skin, or it's just your arms and face?
If you're out swimming, obviously you're going to be absorbing more, but at that point we probably should be wearing sunscreen. So when you wear sunscreen, you're going to get like about a quarter of what you would normally get otherwise.
Oh, so the sunscreen blocks vitamin D.
Yeah,
as
well,
well.
block the conversion, because it's blocking UV rays.
I
So
see.
UV rays hit your skin and getting to your, just arms and legs. I mean, your face, actually, your exposed skin.
So 15 minutes of
Yeah,
arms.
Yeah,
and,
if you're wearing shorts and a t-shirt,
yeah.
you're perfect.
I mean, if you were just hands and face because it's in the fall, is that going to?
You're gonna make some, but I don't know that I could tell you a definitive
Yeah. Well,
time,
right.
but it's certainly you're gonna absorb some. But
Sure.
yeah, I mean, if you have more, if your arms
It'll
are
give me an
exposed,
excuse to stay outside in the fall, which I really enjoy. In case
Exactly.
my wife wants me to come in and do
yeah,
housework,
gotta rake some leaves.
I got to be outside, dear.
Yep.
Or
yeah.
actually, she'll want to be out with me. She
But it's
loves
got to be up to
outside.
October. After October, you're going to lose that benefit. So
All right. Well, we'll have other excuses.
there's always an excuse.
All right. So Anything else, Chris, that we want to?
No, I mean, it's just something, I guess, from protecting from a disease standpoint, it's important for our immune system, so that's critical. If you think you're low, your doctor would probably have to take a lab value to determine that. And
If you want a number.
yeah, if you want a physical number, you're like, man, I just don't feel right. Something's going on. Could we check my D levels? Doesn't hurt. So,
Yeah.
because there's a lot of things that are triggered by not having enough D.
Yep.
So it's certainly something that I think it's safe to supplement, but always ask your doctor. Keep
Yeah.
them in the loop. It's important.
Sure, you bet. All right. Well, enjoy your sunlight and take your supplements when you need it. We want to stay healthy, fit, and pain-free. How
Have a
was
good day.
that, huh?
Have a good day,
I had
guys.
to practice that.